So important topics for nutrition science exam and dietetics as well. So chapter 2, that is RDA. Chapter 1, it is just read it once, it's like a novel. You don't have to worry much about chapter 1. Chapter 2 onwards, RDA. Yeah, exams can be given on Sunday as well. See what, when coming to chapter 2 RDA, what is estimated average requirement, definition, recommended daily allowance, definition, difference between them. Okay, factors affecting RDA, variability, nutrition requirement, dietary factors. Okay, general principles of deriving RDA, all those principles. Determination of RDA of different nutrients. Reference man and woman. Applications of RDA. Okay, that's it. Next, coming to carbohydrates, chapter 3 and chapter 4, that is carbohydrates part 1 and part 2. Classification of carbohydrates, monosaccharides, disaccharides, polysaccharides, okay, all this classification, examples as well. Functions of carbohydrates, very important, functions of carbohydrates. Digestion and absorption of carbohydrates, just study from the video that has been uploaded, study from the video, that is more than enough. Metabolism of carbohydrates, maintenance of blood glucose levels based on hormonal maintenance. Hormonal maintenance is important here. RDA of carbohydrates. In the chapter of dietary fiber, chapter 4. Dietary fiber, different types of dietary fiber, insoluble, soluble. Effects of nutrients, dietary fibers, effects of nutrients. Water holding capacity, absorption and binding capacity, fermentability, constipation, diverticula, and the role of dietary fiber, RD of dietary fiber. Sources and all you don't have to worry about because that's for your practical purpose, okay? Once you get the link on 17th, it will be valid till 25th August midnight, okay? After 25th August midnight, it will not work anymore, okay? This recording will be uploaded in the YouTube as well, so that once even if you are not keeping up with the pace, using the recording, you can get the information later, okay? Coming to the chapter of proteins, different types of proteins, classification, properties of proteins. What is essential amino acids, non-essential amino acids, complete protein, partially incomplete protein, incomplete proteins, etc. Functions of protein, very important. Functions of protein. Digestion and absorption of protein, metabolism of protein. Digestion and absorption, metabolism, whenever it comes, wherever it comes, just focus on what I have explained in the YouTube videos, okay, what we have took in classes on presentation, okay, because you may find it very difficult and very scientific format of explanation in the textbook. So it's better for your understanding, just to understand the concept, you can go and study from the recorded sessions, okay. Factors affecting protein utilization, important. Quality of protein, but do not study or do not mug up any of the formulas. Don't worry about the formulas, all the biological essays given, do not worry about it, okay. Scoring system, very important. Amino acid score, PDCA score, DIAS score, okay. In the video, I have explained it thoroughly. Just see the video, you will understand the concept. If you read this textbook, it will be quite difficult for you, specifically if you're from a non-science background. So just focus on what has been explained on the video. Complementary value of protein, that part is important. RDA of protein, just see the table. Don't mug up the table, just understand where the table comes. Lipids, next chapter is lipids. So again, classification of lipids, compound complex lipids, medium chain fatty acid, Fats in body, different types of fats in body. Fats in food. Functions of fat, functions of lipid in body, very important. Again, digestion and absorption from the video. Essential fatty acid, omega-3, omega-6, omega-9. No need to by heart any of those scientific names of examples given. Okay. Just the general functions of essential amino acids, that is important. Specific functions, general functions. Deficiency of essential amino acid. RDA of essential amino acid, what is the ratio you have to focus? That's from lipids chapter. Energy, next is your energy balance chapter. Direct and indirect calorimetry. Total energy requirement. Basal metabolic rate. Only study the topic which I am reading out, nothing else. Physical activity ratio, physical activity level. The table 7.6, physical activity levels, sedentary, moderate work, heavy work, the levels what we use, okay, that is used in formula, okay. Thermic effect of food. Resting energy expenditure. Factors affecting physical activity. Factors affecting basal metabolic rate. That's it. That's from energy balance chapter. Severe acute malnutrition, the entire chapter is important. We have discussed it yesterday in yesterday's class. Whatever I have took in the video, the entire part is important. Macrominerals, macronutrients and macrominerals, calcium, phosphorus, and magnesium. Only study the RDA, functions, storage, deficiency, toxicity. That's it. From the entire chapter. That's what you have to focus on. What are the RDA, functions, storage, deficiency, and toxicity of each of this macrominerals. Even in electrolytes, functions, focus on the functions. RDA. That's it. Toxicity, deficiency. Water electrolyte balance. Distribution of water. How is water distributed in the body? Distribution of water, they have explained well. Functions of water, very important. Requirements, just read it through. Water balance. Thirst mechanism, kidneys, maintenance of fluids, just read that. Edema, water depletion, that is what is the effect of dehydration. Electrolytes, from the water imbalance, water electrolyte balance, you do not have to read because the entire chapter of electrolytes is before it. In detail, they have explained everything. The electrolyte part in this chapter, water electrolyte balance chapter, is just a repetition. Okay, so just study from one source. Microminerals, part 1, that is iron. Chapter 12, chapter 13 and 14. That is regarding the iron chapter, okay, and iodine. And chapter 14 is about copper, fluorine, zinc, chromium, and selenium. From all these 3 chapters, RDA, functions, storage, deficiency, toxicity. Be thorough in this, okay? No need to study or mug up anything that is in detail. Just focus on these 4 topics. Read the chapter, you will understand exactly what I am saying here. Functions of each of the microminerals from these 3 chapters. How is it stored? In deficiency, what happens? What do you call the deficiencies? In toxicity, what happens? And what is the RDA? Okay, that's what you have to focus. Again, RDA, no need to mug up. Just understand where the table comes. Okay, if RDA related questions come, it's an open book examination. Okay, you should understand where the chapter is. Just open that and just fill up the correct details. That's it. Is it clear to all? So far, is it clear to all? Next is fat soluble vitamins. That is chapter 15, 16, 17. Those who have new edition textbook, chapter numbers may vary a little bit. So I'll read out the chapter name. Fat soluble vitamin part 1 is vitamin A. Part 2 is vitamin A deficiencies. And part 3 is vitamin D, E, and K. Okay, the common thing from fat soluble vitamins you have to study is RDA, function, storage, deficiency, and toxicity. But when it comes to part 2, that is vitamin A deficiency, study about the what causes the deficiencies, how does the vitamin A deficiency take place? Okay, epidemiology, clinical features, how does it take place? That is the etiology. Okay, night blindness, the classification of vitamin A deficiency, specifically that affects the eye, effects of eye. Just read the names. Okay, what happens after what? First, it starts with night blindness, then it goes to mitoid spots, then corneal xerosis, keratomalacia, corneal scar. Okay, just understand that classification. Effect on growth, effect on reproduction, vitamin A deficiency and pregnancy. That's an important topic. Evaluation of vitamin A status, different tests have been given. Just read that once. Prevention part and treatment part, specifically the treatment schedule, table 16.3, treatment schedule. How do you provide that oil miscible oral vitamin A? Okay, it is given as a part of ICDS program. Okay, the what kind of international units, how much dosage has to be given for a child who is less than 1 year of age, more than 1 year of age. Okay, that you have to study. Different national programs they have mentioned, the prevention strategies. Please read through that, okay? Because teaching people about the prevention strategy is very important when it comes to being a nutritionist and dietitian. Okay, so these prevention strategies are very important from this particular chapter. Chapter 16. Nutritional supplements, prevention of infection, biofortification. These are the important topics from this chapter. Okay. Apart from that, chapter 15 and chapter 17 just focus on RDA, functions, storage, deficiency, toxicity. That's it. Next is water-soluble vitamins. That is vitamin B. 3 parts they have given vitamin B. First part is thiamine, riboflavin, niacin. Second part is folic acid and vitamin B12. Third part is vitamin B6, pantothenic acid, and biotin. Okay. So again, in these chapters, I have given an assignment long back. If you have done that assignment will be very helpful for you. The different names of vitamin B complexes, their RDA, their functions, how they are stored in the body, deficiency and toxicity. This you have to put into a tabular format and then just study this. Okay, don't need to go very deep into the scientific part of it. You should know exactly what deficiency is seen in specific kind of vitamin B complex. That is very important here. Okay. And the sources, specific sources of vitamin B. That is for your practical purpose. In exam, source-related questions will usually not come. Okay. But in your assignment, I have mentioned sources as well that you have to do because for practical purpose, it is important. Okay. Just focus on what is given in your textbook when it comes to RDA. Okay. ICMR latest one is just for your practical purpose. RDA based questions are also not there much. Okay. Vitamin C also you have to focus the same. That is also water soluble vitamin. RDA, function, storage, deficiency, toxicity. Again, in sources, you do not have to worry much. Vitamin-like substances, choline, carnitine, coenzyme Q10, lipoic acid, inositol. What I have discussed in the video, which is there in the recorded sessions in YouTube channel, just read that. Okay, that is more than enough for vitamin-like substances chapter. Nutrients and organ health, just read through the entire chapter. It's a very simple chapter. Okay, just like a novel, just read it through. You will understand the concept. They have explained it very well. It is not too complicated, this chapter. Okay, nutrients and organ health. Just understand the concept of this chapter. Antioxidants, it's a self-study chapter. Much questions will not come, but what you have to focus here is the different names of antioxidants. Okay, primary antioxidants, secondary antioxidant. Okay, these things you should know. Carotenoids, vitamin E. Okay. Effect of antioxidants and how it is related to different diseases. Just read through it. It's a self-study chapter. Okay. If you have any queries, you can contact me personally. Focus first on reading these important topics which I have mentioned, and then go to the videos. Okay. If you are not able to understand the concept, important topics which I have discussed right now, if it is difficult for you to understand just by reading, use videos as a help. Okay. Or you can use both the mediums. Just put on the video, let the video go on, understand the concept from the video, read the same topic in the textbook also. Pause the video and read the topic in the textbook also. You can do it however you prefer. Nutritional supplements, it's a simple chapter. Types of nutritional supplements. And different functions of different nutritional supplements is given. Just go through it once. Nutrition and infection, again, it's a self-study chapter. Recording is also available. Very easy to understand nutrition and infection. The main focus of this chapter is effect of infection on nutritional status, effect of infection on nutrients. Okay, what will happen to your entire body's nutritional status when you are infected, and what will happen to specific nutrients when you're infected. Okay, these two aspects are very important from this chapter. Okay, rest of the topics you can just read it through once. Nutrigenomics, difference between nutrigenomics and nutrigenetics. If just focus on what is given in the video. Okay, principles of nutrigenomics. Interaction between nutrient and gene, direct and epigenetic interaction, genetic variation, that's it. Tools in nutrigenomics, just the tools, the brief discussion which is given, you have to read that only. In detail, they have given the description. Don't go there because it is too scientific. It is not required for your diploma level course. Okay. Genomics, proteomics, metabolomics, transcriptomics, just a statement explanation of all these different types of tools. That's what it is important for you. Okay. Don't go much deeper. If you are curious, you can definitely read it. Okay. But don't expect anything too difficult from this chapter. Bioactive components of genes, chronic disease and nutritional genomics. That's it. In the dietetics textbook, menu planning is a very important chapter for practical purpose as well. In detail, we have discussed menu planning many times. Okay. You will be going to menu planning time and again whenever you are preparing a diet plan or menu plan. Okay. So that the entire chapter is kind of important. You can't miss any points from that. Okay. Food and nutritional requirements of adults, just focus on the requirements. Okay, like nutritional requirement is a topic which is there in all such chapters. Just focus on that requirements. That is more than enough. How much calories, how much protein, okay, what is the carbohydrate intake, vitamin intake. Just focus on this requirement. That is more than enough. Same for infants as well. Just the nutritional requirements and certain principles. About breast milk as well in infants, about breast milk as well, artificial feeding. Don't worry much about low birth weight baby, preterm baby. We have discussed in video, but much questions won't come from here. Feeding problems in infant. In preschool children as well, nutritional requirement, food requirement. Whatever principles and guidelines are there, just focus there. School children also, nutritional requirements and principles and guidelines of making school lunches, packed lunches. There are certain guidelines given, just read that once. Expectant mother, again, dietary guidelines, food requirements, nutritional requirements. Nutritional problems also you can read in adolescence. Expected mother, lactating mother, same requirements and guidelines of making a food. Chapter 2, adjuncts to diet therapy, it's just a self-study chapter. Very simple chapter. Okay. You just have to read it like a novel. Much questions will not come. Elderly, again, requirements, dietary guidelines. Coming to nutritional anemia, causes of anemia, very important. A simple table is given, table 11.1. Causes of anemia is very important. Types of anemia. Iron deficiency anemia, what are the reasons of iron deficiency anemia? Etiology. Diagnosis. Stages of anemia, important. Clinical findings, you can just read through it once. Treatment, read that thoroughly. Read treatment using the nutritional supplements thoroughly. Megaloblastic anemia, vitamin B12 deficiency anemia. Again, the causes. Folate deficiency anemia, causes. How does it happen? How can you treat it? Prevention of anemia in general, diet, supplementation. Those are important parts. Fortification, read the fortification properly. It's very important. Diet therapy, dietary supplements, glycemic index, glycemic load, prebiotics, probiotics, artificial sweeteners, just read it once. Importance of stevia. Stevia related questions can come. Food and drug interaction, you don't have to worry about it much, okay? Food and drug interaction, don't worry much. Therapeutic diet, immunonutrition, routine hospital diets, clear fluid diet, full fluid diet, soft diet, regular diet, normal diet, tube feeding, parenteral feeding, enteral feeding, oral supplements. Types of food which is given through tube feeding. Total parenteral nutrition, don't get worried about it. Lots of formulas, everything is used, but that's only for clinical practitioners. Okay. TPN is for clinical practitioner, not for dietitians and nutritionists. So anything and everything about TPN, you have to understand what is TPN, but the formula to it, how to make a TPN and all, we don't have to worry about it, because only doctors are supposed to make these formulas, prescribe these formulas. Nurses are supposed to make it and administer it to the patients. Refeeding syndrome. Malnutrition, wound healing. Infection and fevers, all topics. It's a very small chapter. All topics are important. Obesity and underweight, all topics are important. Cardiovascular diseases, focus on the dietary management. Gastrointestinal diseases, all topics, different topics different types of gastrointestinal diseases are given. So the management. Focus on that. Liver and pancreas, again, all topics. Diabetic mellitus, all topics. Kidney diseases. Food sensitivity. What is food sensitivity? Food intolerance, food allergies. How do you diagnose it? Okay, how do you manage it? Errors of metabolism, meaning and types. That's it. What does it mean and what are the different types of errors of metabolism? Cancer, diet in cancer, all topics. Special diets, all topics. Dietitian, questions will not come. It is just for your understanding. The chapter 25 of dietitian is just for your understanding. So this is a question from nutrition science textbook. What is the full form of DIAS? You can answer in the chat box. What is the correct answer to this? What is the full form of DIAS? DIAS score is from the protein chapter. Is it the first option or the second option? Yeah, it is the second option. Digestible indispensable amino acid score. Second option is the right answer. Water intoxication leads to what? Overhydration, hyponatremia, or both? Which is the correct answer? Third, okay, it leads to overhydration of cells along with hyponatremia. Sodium levels will fall drastically if you drink too much of water. Okay. From dietetics, two questions are there. Iron deficiency anemia is due to, what do you think is the correct answer to it? Inadequate iron intake, blood loss, inadequate iron absorption, or all of the above? Read all the options properly, then answer, okay? Yes, it's the fourth option, all of the above. Stevioside is 300 times sweeter than sucrose. Sucrose is found in sugar, okay? Stevioside is 300 times sweeter than sucrose. Is this true or false? Stevioside is found in stevia.